So welcome to the webinar, and thank you everybody in advance for your time and attention. My name is Todd Patilla, and I will be moderating the session today and introducing our distinguished guest speaker for today's webinar. And I'm excited for this webinar today. It's titled Operationalizing 3D Printing at the Point of Care, and this will be presented by Sarah Flora, who is the Program Director for 3D Imaging and 3D Printing at Geisinger Medical Center. The duration of the webinar will be less than 30 minutes, so we appreciate your attention during this time. At the conclusion of Sarah's presentation, we will answer a few questions via a Q&A session, and then we will wrap up the webinar with some concluding remarks. So it's my pleasure to introduce Sarah Flora. Sarah Flora is the Program Director of Radiology's 3D lab at Geisinger. It's a 14-hospital system spanning across Pennsylvania and New Jersey, and in her role, Sarah leads an elite group of MRI and CT technologists in the processing of on-screen medical reconstructions. Additionally, Sarah segments and designs and 3D prints patient-specific medical models to aid in pre-surgical planning, patient and learner education, surgical simulation, and surgical aid tools. She has a bachelor's degree in medical imaging and is currently enrolled in the Master's of Engineering program in additive manufacturing and design at Penn State. She's also an active member and contributor to the American Society of Radiologic Technologists, the American Society of Mechanical Engineering's 3D Printing Medical Workgroup, and the Radiologic Society of North America's 3D Printing Special Interest Group. So with that, I'm happy to pass the presentation to Sarah.
Thank you, Todd, and welcome everyone. I'm Sarah Flora, Program Director for the Radiology 3D Lab at Geisinger Medical Center, and today I wanted to discuss how our radiology department integrated 3D printing into our standard medical workflow to improve our patients' care across our entire health system. I have nothing to disclose, and Geisinger is a rather large health system that was established in rural Pennsylvania. Currently, we have a multitude of hospitals, research and simulation centers, a medical school, and our own health insurance plan. In 2012, we established a radiology 3D lab where technologists process exams throughout the entire Geisinger health system. This means if two different patients that are on two separate sides of the state receive imaging, their reconstructions and measurements processed and sent to PACS will be the same. This has tremendously helped standardize imaging throughout the entire system, as well as alleviate time that the CT or MRI tech would have had to spend processing the study, which is increasing throughput. So as you can see, technologists in the 3D imaging lab are skilled in medical segmentation and process a lot of studies a month. This background has paved the way to integrating medical 3D printing in our lab. I always get asked how I got into medical 3D printing, and I'd like to say that it was our plan all along, but we kind of fell into our laps. A cardiologist in our health system that was a 3D print enthusiast asked us to segment parts of the heart for him to print. Even with our background in medical segmentation, this was not an easy task. We all had very vague recollections of 3D printing, but none of us had any idea how to apply this to what we were currently doing. After lots of web searching and calls to technical support, we gave it a try. The model was a success, and shortly after that, Radiology decided to purchase a small desktop printer and see what we could really do. These were our first attempts at 3D printing. I really love this picture because even though it's just a small little robot that has absolutely nothing to do with medicine, it shows our progression and how we increased our knowledge base until we finally had a successful print. Once we understood the process, we were able to start providing simplified patient-specific models to cardiology and orthopedics. I say simplified models because at the time we used what we had already in the lab for segmenting and freeware for designing and fixing our files. In 2015, we printed 12 medical models, which allowed us to justify applying for internal grant funding in order to develop a program. You can really see the progression as the years go by in the quality and complexity of our models. Like I said, internal grant funding helped us establish this program, and it gave us the tools we needed, like extensive training, high-end printers, and dedicated segmentation and design software to provide these great models. Without the support from our administration and the ongoing training, we would not be as successful as we are. So today the Geisinger 3D lab is a fully integrated medical 3D printing lab housed in the radiology department at our Danville campus. We provide models to any requesting physician through the entire health system for pre-surgical planning, surgical simulation, staff, resident, and patient education, as well as tools that can be used to help in surgical procedures. Here are some examples of models we produce for pre-surgical planning. These models provide the surgeon with useful information like location of particular pathology and its adjacent structures, all in full-scale models they can hold in their own hands and plan from. In multidisciplinary team planning, each surgeon on the team might create their own assumptions from reviewing the imaging. The models created put everything into perspective, answering any questions they had, so they can focus more on the patient's care rather than resolving the discrepancies in each person's opinion. Surgical simulation is also one of the more common use cases for our models. This is where we print a model that a surgeon will use to practice or simulate a procedure on. As you can tell, we have proven this is very valuable for the simple fact that they can do this in a very low-stress environment and decide what approach works best before the patient is even in the hospital. Knowing what's in store for them or what instruments to use before the procedure is dramatically decreasing the OR time as well as increasing the confidence in the surgeon. We're not saying models will prevent complications during these procedures, but they can potentially predict how successful the procedure might be while allowing the surgeon to practice on that specific patient's anatomy. Like the models used for surgical simulation, 3D printed educational models are a huge benefit to any hospital. These models allow learners to educate themselves on complex anatomy, simulate procedures on normal anatomy, and increase their knowledge base without any patient interaction. Some procedures are taught with the see one, do one, teach one method because there aren't any applicable training models available to purchase, and if there is, the costs are extremely high. 3D printing has allowed hospitals to create their own teaching models tailored to their own methods and training that seamlessly integrate the haptic sense into anatomically correct models inside and out. Models can also be used to aid in the actual surgery itself. Here we see on the left a set of rib fractures that the surgeon bent plates on, which will get sterilized and implanted into the patient. The reason they like to do it this way is because they can bend these plates in their office on their own time and not have to worry about bending them in the OR on the patient's fractured ribs. It decreases OR time and can lead to smaller incision sizes and even less pain. Another request we had was to print the patient's skull and mold their brain in flexible silicone. The neurosurgeon that wanted this was switching to a different vendor for equipment in his procedures, but was uncomfortable testing it out with his next patient. So he took the model into the OR on a Saturday, where his entire team and the vendor came and they simulated this procedure from start to finish. This allowed them to work out any kinks and figure out what everyone's role was before the actual patient was on that table. When it was time for the surgery, everyone on the team knew exactly what they needed to do, and the procedure went seamlessly with very little stress involved. So we talk a lot about how 3D printing is helping the physicians, but we forget the one person this might help the most. If you think about it, the patient rarely has any medical background and is trusting that their physician is doing what's best for them. Even if the patients are shown a CT or MRI scan, it's hard for them to comprehend what's going on because their brain isn't geared to work that way. When we print models for patient education, they go from not really knowing what's going on to becoming fully immersed in their condition and their care. Showing the patient the model of their own anatomy is also improving informed consent tremendously. Now the patient and physician can sit together, hold their model, and talk face-to-face about their plan. So our workflow is quite similar to most hospital-based 3D printing labs, where we receive the request, segment and design the model, check what we did with the physician, print and post-process the model, and perform a quality check, and then hand off the model to the requesting physician, as well as collect any feedback given to improve on the process. As you can see in these images, there are errors or discrepancies that cause us to move back to the previous step and resolve prior to moving on. When the surgeons opened the viewer for the model on the left, they realized the structures included in the maps aren't visualized with an opaque model. So we had to change our plan and create a hollow, clear map that can allow them to see what's inside. The model on the right is an error from the printer itself, so this caused us to diagnose the problem and reprint after it was resolved. I want to talk more about our workflow and show you all some tools that we use to help us along the way. We found it's a lot easier to have all available resources for ordering a model included in our internal website. This includes a request form, some suggested scan parameters, and contact information if they have any questions. This site is easily accessible and searchable internally for any Geisinger facility to learn more about our lab and how to request a model. The internal request form allows us to simplify our ordering process for a model. As most of you know, you really can 3D print anything. So your time and the cost of the models are both quite valuable, and communication is key. We perform multiple consultations throughout the process in order to give the requesting physician exactly what they want without starting over or reprinting. The request form narrows down their options and starts to give us the information needed to look into the case prior to the first communication. In most cases, especially when we first started out, we were working with data that was already acquired through CT or MRI scans. The more relied upon we are, the more we are witnessing physicians thinking about using a model before the patient receives imaging. Suggested scan parameters allow them to order the imaging that would help us get the best model for them while also commenting specific phases, slice thicknesses, or windows that should be scanned so the technologists are on the same page as well. Segmentation and design are by far the most important and most labor-intensive steps in the entire process. This is where you can really benefit from someone skilled in medical segmentation. We use Materialise mimics for all of our segmentation and 3matic for all of our designing. We have found the tools are quite similar to what we're used to while still being dedicated to medical 3D printing. I especially like the Fix wizard that's shown here. It's a diagnostic tool that allows you to repair your parts prior to printing to make sure that you have a sound model. After segmentation and design, the contours of each part are overlaid onto the original DICOM data set to confirm placement and coverage. Once all is confirmed, the parts are uploaded to the mimics viewer and the case is sent to the requesting physician to approve or request changes. Since we have so many hospitals in our health system, the online viewer is very helpful in allowing physicians all over to view a live preview of the model as it'll look post-print. The ability for them to check the part contours on the DICOM data is not only great for reviewing, but for planning purposes as well. So once the physician approves the model, it can then be sent to one of the many printers we have in-house depending on its use case and how they want the final model to function. Printing takes anywhere from 6 to 60 hours depending on the size and complexity of the model, as well as the print technology used. Post-processing and quality checks of the final model are then performed prior to handing the model off to the physician. Sometimes we're able to meet in person for model delivery, and sometimes we need to send them via courier to whatever facility they request. A 3D print worksheet is included with every model handoff. This is also saved in the patient's medical record as a quick reference. We also send a feedback form to the physician about a week after delivery to give them time to really use the model before commenting on it. I tried to make the form as easy as possible to fill out while still getting as much information as we can about the process and the model. Collecting feedback is key to improving your process as well as justifying a program to your facility. Managing your workflow is also very important. Being able to see real-time statistics tracking any step in the process is essential to managing your program. A dashboard like the one below gives me a quick summary of where in the process we need the most help for the day. It's also easy to export data from, which is helpful if you need to pull any information like print usage, service lines that are commonly requesting the models, and even how much material you are using at a given time. Quality assurance is used to validate what you segment from the DICOM images is actually what you print. It kind of sounds funny to say that because we obviously want to print what we segment, but there can be flaws in any step of this process that prevents that. Using 510K cleared software to segment and design like Materialise helps confirm those steps, and in some cases the clearance runs the entire way through the print process as well. However, not all printers are cleared, and additional steps need to be in place to confirm the quality and accuracy of your models. As you can see below, we run monthly QA coupons that can be measured and compared to the digital model. The coupon on the left has ridges through it, which actually turned out to be a faulty UV light. Once replaced, the model on the right was printed, which resolved the issue. The RSNA 3D Printing Special Interest Group, or SIG, is in the process of developing suggested QA standards for printing at the point of care to help shine light on all areas in the process where QA is needed and help alleviate any confusion. If you are new to medical 3D printing, I highly suggest visiting the link above and looking into joining the SIG. There are so many resources and documents to help you, as well as the ability to network and collaborate with other labs across the country. It really is a great resource for anyone in our field. The big elephant in the room is always cost. How do you support a program and how do you charge for these models? And it's really easy, especially for administration and a health system, to see all the models that can be produced and immediately think, how can we make money off of this? It's our job to reroute that train of thought to the bigger picture. Yes, these models cost money and time to produce, but as you saw in the previous slide, they're valuable in other ways, like improved education and patient care, as well as time reductions anywhere along that patient's treatment. In a hospital, time is money, and if you can simplify a procedure and decrease the amount of time it takes, you're saving the hospital money. It's hard to change the way we think. We're obviously not making money off running a program like this, but this is what's best for our patients and our physicians, and it's decreasing costs across the entire system. When our grant funding ran out, I put together a case for radiology. This included information like how many models we did, how much we spent on materials to print these models through the years, and how much time we dedicated to the program, followed by testimonials from our physicians and a calculated amount of money saved from decreased OR time and savings from providing the models in-house versus outsourcing them. The cost savings was enormous, and it was a no-brainer for radiology to decide to fully fund our program indefinitely. If you're having problems or having trouble with this still, the AMA just released Category 3 CPT codes for elective reimbursements of 3D printed medical models and guides. So as you can see, a quick Google search will flood you with information about the codes. Since this is the first step to mandatory reimbursement, it's a very exciting time for us all. So like I said, Category 3 codes are electively reimbursed, and at this stage, it's more about coding them out to collect data from hospitals utilizing the service and storing it in the ACR registry in order to prove its value across the nation. We all know it's valuable, now it's our responsibility to prove it. As you can see, we've had some great growth through the years, and I have to contribute it to the providers that are discovering the ways that these models can help them and their patients. Without brainstorming and sharing their ideas with us about what they would like to see or what they would like the model to do, we wouldn't be looking outside of the box and pushing ourselves to grow. No matter what someone requests, even if it seems kind of crazy, we try everything we can to provide them with a model or multiple models that can help them achieve their goal. That's one of the main reasons we are successful in our lab. So I can summarize all of this into 5 main keys that led to our success. Like I said, keeping an open mind and allowing the physicians to brainstorm is really important. Some of our best models were created from ideas the requesting physician had that we were in turn able to produce. Using dedicated software for medical segmentation and design can make some processes in your workflow a lot easier and more effective. If possible, purchase different types of printers that can complement each other. They're all great for something and maybe not as great for something else, but you want to keep downtime in mind as well. If this printer goes down, do I have a backup for that particular material? If your funding is restrictive, try outsourcing your models at first. That way you can start to collect data on what is being used the most and what types of printers to look into in the future. Outsourcing at first is also a great way to test the waters and see if your physicians will find printed models useful. It also allows you to easily track funds spent on outsourcing for eventually justifying an in-house lab in the future. Logistically, having a print lab in the hospital might not make sense. Space in the facility you're in is probably hard to come by, but the ability for a physician to walk over to your lab to discuss a case or pick up a model is very impactful. Lastly, and most importantly, we strive to produce high-quality models for our physicians. A dedicated QA program will help with this. If you establish a lab and are providing models that could be used in the patient's care, it's your responsibility to make sure the models are printed accurately. Software and printers can be accurate, but some small hiccups could lead to big problems. So it's important to keep up with quality assurance and making sure you're giving the physicians high-quality medical models. And on that note, I wanted to thank Todd and the entire Materialise team for allowing me to share this information with you all. And of course, if anyone has any questions or would like to discuss anything from today, please feel free to email me at the email address listed above. Thank you all for your time and take care.
Thank you, Sarah, for the excellent and inspiring presentation. Really well done. I have a few questions for you before we conclude the webinar today. My first question, Sarah, is for those that are looking to get started, how does someone learn more or obtain training in medical 3D printing?
Yeah, so there's quite an array of professionals in this field, and every hospital is staffed differently. I know physicians, biomedical engineers, technologists, and medical illustrators that are developing programs around the country. I think the best place for anyone to start researching is the RSNA Special Interest Group. Like I said, there are so many great resources at your disposal, as well as the ability to communicate and collaborate with all of the hospital-based programs across the country.
And Sarah, how would you say the 3D printing work has impacted the collaboration between radiology and the surgical specialties?
I think it's definitely strengthened the bonds between radiology and other surgical disciplinary teams. We first started this program in radiology because of our medical segmentation background from the 3D lab, but after we started to grow and develop, we realized housing a lab in radiology was the right call for many different reasons. The radiology department in most hospitals is normally centrally located, so easy access for anyone to come down for a consult or pick up a model. We can also review contours of segmented anatomy fairly easily with the radiologist prior to printing, and our main input for segmenting is from radiological data. So it's become a no-brainer for us to allow this to stay as an expansion of radiology procedures offered to our staff.
That's great. And Sarah, looking to the future, you're obviously one of the early adopters, one of the innovators in this space, but what would you say are the biggest needs to ensure the future of 3D printing in hospitals? What's needed to continue and drive the future?
Yeah, definitely. So I think the biggest thing is proving the value of these models. Like I said, we're not bringing in revenue, but we're saving the entire health system by doing this. We've taken a one Geisinger approach, as in we agree to fund this program indefinitely as long as we continue to prove that it's a valuable service to offer. And I think the more major medical centers that do the same, the more publications that come out about the value of medical 3D printing, the easier it will be to make this part of the patient's standard of care. Like I said, we know it's useful, and now it's our job to prove it to others that might not think the same way. Once the value is proven, insurance reimbursements should follow suit, which would pave the way for new and upcoming point-of-care programs.
Agreed. Thank you, Sarah. I wanted to mention additional resources in the form of technical white papers published by Sarah and the Geisinger team. So please, if you're interested to learn more on these topics, one white paper titled 3D Printing from Radiology Images, DICOM Segmentation Comparison, the other Hospital 3D Printing, A Clear Path to Value Capture. If you're interested in these topics, please visit our website to download these white papers. Additionally, please join us at upcoming meetings. The RSNA annual meeting in December, which is being held December 1st through 6th, will host a number of learning opportunities for medical 3D printing. The RSNA Special Interest Group on 3D printing, which Sarah mentioned, will also be present hosting meetings. So please look us up if you're attending RSNA. Next year, March 6th through 8th, the RSNA will also host a dedicated medical 3D printing course, the first annual meeting that RSNA will host on 3D printing. And then also looking forward to the American Academy of Orthopedic Surgeons, AAOS, the 2020 meeting in March in Orlando next year. So if you're attending these meetings, please feel free to reach out to Materialise and take the opportunity to meet. If you enjoyed this webinar, please check out other webinars in this series from our website. And if you want to learn more, please contact your local Materialise representative or send us an email. Also, please visit our website. We have a dedicated website on point-of-care 3D printing with a number of additional resources that are related to the topic of this webinar. And with that, I thank you all for your time and attention. I look forward to the opportunity to discuss your 3D printing vision, your goals and objectives, and we're always happy to have that conversation. Thanks again, and enjoy the rest of your day.